Hello, I'm Dr. Perino, one of the radiologists here at South Sound Radiology. Your doctor has requested that we perform a spinal facet joint injection on you. The procedure will be performed by a radiologist with the assistance of a radiologic technologist. I would like to take the next few minutes to describe the procedure, its risks, potential benefits, and alternatives. But first, let me give you some background information on the facet joints, the role in back pain, and why we are performing the procedure on you. I hope that this video answers most of your questions. You will have time to ask any questions either to the technologist or the radiologist before getting started. What are the facet joints? These joints provide stability and give us the ability to bend and twist. Like most joints, they are lined by cartilage and filled with a very small amount of lubricating fluid. There are two potential benefits of the procedure. First, to confirm that a particular facet joint is the source of back pain, that is diagnosis, or second, to treat the source of pain, that is therapy. Facet injections are usually ordered for diagnosis and treatment of low back pain, for focal tenderness over a facet joint, for persistent low back pain after spinal fusion, or as a screening procedure before spinal fusion. How effective are facet injections? Research has found that facet injections give 50 to 90% of patients temporary and 20 to 50% long-term symptomatic improvement of their low back pain. This procedure is intended to help you recover to the degree that you can resume conservative treatments such as physical exercise, yoga, and stretching. But symptomatic improvement is variable and unpredictable. The injection does not correct the underlying abnormality. How are the injections performed? Facet injections are performed while you are awake. The radiologist assistant will clean your back directly over the affected joint. The radiologist will then use a local anesthetic to numb the skin over the injection site. The doctor will use a form of real-time X-ray called fluoroscopy to guide placement of the needle into the joint. Sometimes a CT scan will be required for image guidance when significant degenerative changes obscure the target. Before injecting the medication into the joint capsule, he will inject the joint with a small amount of X-ray dye to confirm that he has achieved optimal needle placement. Your radiologist will inject a solution containing a long-lasting anesthetic and a steroid. The anesthetic is called bupivacaine, also known as sensorcaine. It is a rapid-onset, relatively long-lasting anesthetic. The steroid is called betamethasone. It is a potent synthetic steroid that reduces inflammation and promotes healing. After the injection, the skin site will be cleaned and a Band-Aid placed by the assistant. This process may then be repeated depending upon whether other sites are symptomatic. Although the actual injection only takes a few minutes, the overall procedure usually takes about 30 minutes. So what will I experience during the procedure? You will probably feel a small stick from the anesthetic needle, followed by about a 2 to 3 second slight burning sensation. Then you may experience intermittent pressure sensations with needle positioning and during the injection of medications. Immediately following the procedure, you may feel a reduction or complete relief of your back pain. This may last 1 to 4 hours. After the anesthetic component of the injection wears off, your back pain may return. The therapeutic effects of the steroid may be noticed 1 to 2 days after the procedure, and your symptoms will probably continue to improve for 3 to 7 days. The potential benefits may last from several days to weeks or months. You will be able to walk immediately after the procedure, although some patients may experience leg weakness and numbness or tingling for a few hours. Because your reaction times may be affected by the injection, driving is not recommended. You should have someone drive you home. Once home, you can treat any pain at the injection site with ice or pain medication as prescribed by your referring doctor. It is generally recommended that you take it easy for the first day. After the first day, you can usually return to your activities as your pain will allow. In most cases, you can return to work the day following the injection. You should not have an injection if you are prone to excessive bleeding or are taking anticoagulation medications such as Coumadin or heparin, if your back pain has been diagnosed as a result of an infection or cancer, If you have a known history of a major allergic reaction to anesthetic or steroid solutions, if you have a local infection at the intended injection site, if you are pregnant, if you have a significant active infectious process elsewhere in your body, if you have active bleeding ulcers, treatment-resistant diabetes mellitus, severe uncontrolled high blood pressure, or congestive heart failure. If any of these conditions exist, please notify the radiologic technologist. There are possible complications with just about any medical procedure. These are rare. They include pain at the injection site, bleeding, infection, worsening of your pain, inadvertent dural puncture, nerve injury, or allergic reaction to the medications. Be sure to let us know if you are allergic to X-ray dye. Side effects of steroid medications may include difficulty sleeping, nightmares and nervousness for 1 or 2 nights after the procedure, facial flushing, low-grade fevers for 1 to 3 days, heartburn, stomach pain or nausea, and/or headaches. What are the alternatives to steroid injections? Medical therapy, physical therapy, or surgery? I hope that this briefing has been informative. If you have any questions regarding your procedure, please feel free to ask the radiologic technologist or radiologist.